everyone. On this month's podcast, I'm honored to be joined by Biju Mohandas, who is the partner and head of global healthcare for LeapFrog Investments, and also Ed Burbidge, who is a friend and also head of emerging markets for Icon, a role that he's recently taken up. We're here to talk about basically LeapFrog's exit from Good Life pharmacies and how that transaction went through, and also to learn about Biju himself. I'll be joined by Ed. Ed is co-hosting the podcast this month, so I'm really honored to have him here. Honored to have him asking questions as well. I'm not even in the hot seat now, so this is very good for me. So let's start. Biju.
Yes.
You started in the armed forces in India. How did that come about? Tell us about yourself.
My life in general has been a lot about serendipity. So joining the armed forces was also partly serendipity, in that in 1999 or so, there was a clash or a war between India and Pakistan. It was televised quite widely. In fact, it was the first time that a war was televised in India. And as a result, I volunteered to join the army. And
I mean, you volunteered. That's quite something.
Yeah. However, by the time they assessed me, did all the medical, physical interviews, etc., the war was over. But I still decided to join, and it was life-changing for me. In the context of my work, for instance, when I joined the army, I was posted in the northeastern parts of India, which even now is relatively remote. At that point, it was quite remote and extremely poor, and in the throes of an insurgency, terrorist activities, which the army was trying to quell. And part of the role of the Army Medical Corps was to win the hearts and minds of the people. So we provided medical camps to provide healthcare infrastructure where none existed. And that for me was a bit of an aha moment, because we were running around setting up these little temporary camps, providing healthcare, which is a permanent need for people. At the same time, the private sector, modern capital, had ensured that all these people in remote places were able to get confectionaries and Pepsi and alcohol and beer and so on. They had figured it out. Not just they were poor, but they had figured out ways to get it to them in a manner which was affordable to them.
Yeah. Mm-hmm.
So that caused me to ask the question, why is it that we are not able to use the force of capitalism to deliver healthcare to these people in these parts? That's the question I've been trying to answer since 25 years.
So you always knew you wanted to be in healthcare, and I guess impact investing. No.
So this happened. Mm-hmm. I joined the army. I knew that for me, armed forces, I didn't want it to be a career. I wanted it to be a vocation. So I served 5 years. It's called the Short Service Commission in India. I joined as a lieutenant, left as a major, and then went to business school, where my thought was, being with my clinical background, operational service in the army, which ended up being mostly operational. I did very little clinical work. I would end up managing healthcare operations somewhere. So I didn't even know what impact investing was until, again, serendipity. I went to a party that a few exchange students threw. There might have been some libations involved, and then I got into a conversation with the professor.
Yeah.
And I was telling him exactly what I told you about, what is this? Why is capitalism not able to do this? And he said, well, they're trying now. There's a word, there's a phrase, there's an entire sector that is being formed. This was in 2007.
Yeah.
It's called impact investing. And that night he connected me with the India head of Acumen, which is a pioneering impact investment fund. He wanted to see me the next morning, so I met him. And
that's how it happened.
That's how it started.
Gosh, so how did you join LeapFrog in the end?
LeapFrog happened 5 years ago. So I worked at Acumen for about 6 years, half of which was here in Kenya. Again, serendipity. Okay. There was some leadership changes. Then they wanted me to shuttle between India and Kenya and help manage both of those offices, and ended up finally asking me to move. But I never thought I'll be here this long. That was 16 years ago. And then I left Acumen to join IFC and lead their healthcare and education business in Africa. Though I was technically part of the DC team, I was based in Nairobi.
Okay.
So after serving with IFC for 10 years, I joined LeapFrog 5 years ago.
Gosh, it seems like a lifetime ago, but such a short time ago at the same time. Ed, I want you to come in and take up your role as joint host.
Yeah,
Go
I
ahead.
need to pull my weight a bit, I think. I hope you can hear me okay.
Yep.
So maybe getting sort of more into the sector, the healthcare, health tech sector. It's one of the most active sectors actually for deal making in Africa, and it's interested in the shifts that you've seen in investor appetite and deal making in the sector over the last decade in Africa.
So I started working with a big focus on Africa in 2009. I would say 2009 for 5 odd years, 3 to 5 odd years, starting around that period of time, a lot of the investments into healthcare were being led by relatively small SME focused funds. And therefore the investments were also relatively small. We're talking about $3, $5, $6 odd $1 million tickets. It could be an investment into something like an eye hospital. The investment itself could be just debt, mezzanine, or equity. And over the course of the last decade, that has pretty much petered off. As you know, several of these SME funds have now been either closed or they've been acquired by others. Yeah. I think around 2012-ish, 2012, 2014, there were 2 other sources of capital that started appearing pretty much in parallel. One was large private equity, very healthcare focused, relatively large. The Africa Health Fund, then managed by Oreos. Again, that came into being around the 2009-10 timeframe, if I remember correctly, but really started scaling up in the 2012s. And that was subsequently acquired by Abraj, and then they went and built this $1 billion fund that we all know about. And so investment fund for health in Africa raised a couple of funds with that focus as well, $100 odd million. And then around the same time, while capital was really, really cheap around the world, VC money was flowing into all sorts of sectors. It found its way to Africa as well, and you both were there. You saw it happen. Large VC funds started being set up. So around that time, these 2 new sources of capital came in, far more ambition. In the case of the former, the private equity funds, the ambition was let's build large healthcare, consolidate hospitals, create platforms, consolidate diagnostics, create platforms of diagnostic providers, large manufacturing, large distribution, and so on. And in the case of the latter, it was anything to do with tech. Obviously, a lot of the money went into financial fintech and some of the other retail, transport, and so on. But some capital also found its way into health tech. Now, I think we all know what happened with the former. I personally, and I could be wrong here like anyone else, but personally I felt the overarching idea was that there was some merit to it, in that in economies where healthcare is primarily fragmented, which leads to inconsistent quality, leads to the inability to achieve the economies of scale and therefore provide affordable pricing to your customers, et cetera, et cetera. It made sense. It was just the execution that seemed to be awry. In our case with Good Life, we'll talk about it later, that was the primary thesis. And fingers crossed, it's worked. We've handed it over to a 150-odd-year-old company, hopefully last another 150 years here. So it could have worked, but I think the execution is off, and hopefully we will be able to make it work in the future. In the case of the latter, frankly, the VC ecosystem, I think there's a larger question. So the two of you know this more than I do. I've not done much in the VC space, but do we really have the kind of scale, the total addressable market, the kind of capital that is willing to risk all to back in these markets, particularly in healthcare, and to get those kind of returns, right? Where you don't mind if 6, 7 businesses have gone belly up, but one of them is going to return your entire fund. Is that possible even in the healthcare space?
I don't think it's possible.
So those are the trends that I would say overall 30,000 feet over the last decade or so.
Okay.
Yeah.
We can talk about what I could see or hope going forward.
That's what I want to talk about next, actually. But I like the way you turned it on us and asked us the question, actually. That was rather cleverly done.
Do you want to answer
Njeri. And I'm terrified of trying to answer that, but I think it's a really, really interesting question. I think the capital is there in terms of VC capital directed at health tech. I think it's the second biggest sector after fintech for Africa. I think it benefits from the fact that you can bring in developmental capital alongside, purely commercial venture capital. There's a lot of DFI interest in the sector as well, so you can bring that in alongside. I think also, I guess it plays into what I wanted to ask you next about the next 5 years and how that's going to play out, and the extent to which tech and AI in particular will drive healthcare and health tech and achieving those economies of scale at the same time as impact, actually, in that sector across Africa. Feel free to focus more on the PE end of the scale if you prefer. Very interested in your take on that and how tech and AI drives the next five years.
I would say that just to answer that part of the question on deal making itself, in terms of what, whenever, there's a potential transaction in the healthcare space, and whether it's tech enabled or not, the risk factors are too high for potential investors to take the risks on what can happen. And, they're not willing to do it because, either there's too much exposure, or there's lack of, sophisticated ERP systems or things like that at the back end. And so I have been, we are working on transactions where we're trying to help in the healthcare space, but not achieved anything yet. So, and generally, I think in Africa, if there is a transaction to be done, it's one where people are very, very certain that there will be a return and not willing to take the risk.
Increasingly.
Not willing to take the risk. Yeah. But go ahead, Biju, let's talk about that.
The future, I think ideally it ought to be at the intersection of both consolidated provider networks, tech. So to unpack it a little bit, I do believe consolidation in the provider side, whether you're talking about medical, retail, pharmacy, distribution, etc., or the hospitals, is possible and maybe even necessary. And if executed well, it can happen. What does one require for good execution? I think it is high quality management teams and capital which knows what it is doing. I think people who have tried, there have been little misses here and there. And with private equity, if you lose, say, 18 months, you have lost, because then it is very difficult, particularly with headwinds on macros, etc. It's very difficult to get back decent returns. Then one has to just accept that and take whatever 6-7% IRR and move on, right? But sometimes people don't do that. They try to catch up or keep the valuation high, and net the company doesn't work. So overall, I believe that thesis could still work if someone executes it properly. There are a few people who are out there trying, and I wish them best, and I hope it'll work. There is capital on the private equity side now, even more mature. Those who are left standing are pretty solid investors. So we hope that that comes through. However, for me personally, what is more exciting, and also it's not going to be easy, but quite exciting, is the insurance space. Health insurance, when I was at IFC, one of the things that we try to do outside of the investment bucket on the advisory side was try and catalyze public health insurance across multiple countries, Ghana, Nigeria, Kenya here with NHIF. And sadly, in spite of the best effort and intent, it hasn't entirely worked.
Yeah.
If one could say it has failed spectacularly.
Yeah.
Societies where one doesn't have the safety net of health insurance, particularly when the demographics are such that people are living longer. A Nigerian today, a Kenyan today, an Indian today, they're all living longer than their parents. However, they are also spending about 10 odd years in poor health, which means that if you bring all pieces together, Africa is most African countries continuing to have high population growth.
Yeah.
These guys are going to live longer and they're going to spend long periods of their life in poor health. That means health expenditure is going to rise significantly. So infrastructure is lacking, so that requires consolidation, et cetera, but also healthcare financing is lacking.
Yeah.
People cannot be expected to pay out of pocket. So one needs to have health insurance. However, with all of these things the way I painted it, even the US, the UK, France, all of these countries which have reasonable safety nets, well, not the US, it doesn't have as much outside of Medicare, Medicaid, but the others do have a safety net, but they're struggling because of this longer life, NCD, non-communicable disease burden. So you take that issue and put it here. Without the safety net, imagine the kind of struggle that there will be.
Yeah.
So what does one do? One has to build a health insurance system from scratch that is very different from what others have built, that is centered on prevention and wellness. It needs to shift healthcare from merely treating the sick to enabling wellness and preventing illness in the first place. And whenever someone does get sick, it has to be diagnosed really early and quick treatment has to be provided. And only the truly unfortunate situations should require a lot of inpatient care, very high expense, right? And that is what I'm saying is not just theoretical. This is the reality of modern reality of the diseases that we are all suffering from. I'll give you an example. I found out very recently that I have high cholesterol. I try my best to lead a pretty decent, healthy lifestyle, but genetically, I seem to be predisposed to high cholesterol. The reason I found that out was because one of my portfolio companies that I've invested in India does diagnostics at home. So whenever I go for my quarterly board meetings, they send someone to the hotel, I pay them very quickly, online, everything is done. And they said, okay, you have very, very high cholesterol. Within a day, I started my medication and now pretty normal. Now, if that has not been detected, it could have resulted in all sorts of issues, which would have, this is nothing. I don't even register the amount I've paid them for the test. The medication is really, really cheap. Most of it is generic. So it doesn't hit me. But imagine if this had continued, a surgery would have, so that is what I think that can be built.
What kind of play is that, though?
That play would be, for me at least, it would be someone setting up a special platform wherein they go acquire some of the legacy insurance companies, but then helping those insurance companies come up with products which are more health wellness centered. It will have all the coverage. You could go to an Aga Khan or a Nairobi hospital and get yourself treated, God forbid, if there is a major ailment. But the focus is to try and keep you healthy and therefore reduce your medical cost, which in turn means the premium you need to pay me will be low. And if your health behavior is really, really good, I'll cut down the premium.
But does that work for economies of this size? Is it a middle class play? What about the lower end of the scale?
So it's a great question. It is primarily an emerging consumer play. People who can pay, top of my head, I've not done the math, a few $100s a year to get that kind of a service. But it should also be a low income play. And the way that would work is the government would think of itself as a financier. So this is not theoretical. It has happened in several Indian states, for instance, where the government says, I want to provide health insurance of certain parameters to all my citizens. Now you bid as an insurance provider, how much premium do you need from me? I'll pay the premium.
Okay.
So we are all incentivized to bid for the lowest premium. And then once I get that, then it's up to me to manage the medical costs.
Correct.
So the thing is, in order for this to work, there needs to be exceptional discipline. There needs to be great tech across various aspects, from distribution of these products. You cannot have expensive distribution mechanisms because it has to be low cost. With regards to your actuarial assessment, AI comes into pic. I mean, this day and age, you can easily come up with great actuarial methodology to figure out premium, and that premium can be toggled up and down depending on the behavior. And then, sorry, before you come in terms of also how you could literally, the day you become a premium holder, you get a nice app, which and a wearable. Wearables are getting cheaper and cheaper. You have to wear it. If you don't wear it regularly, then your premium goes up. If you're 100%, then your premium is down. And then based on all of that, you see that this provider wants you to be healthy.
Correct.
And you want to be healthy too. So net everyone wins. So I think there is something like this to be built, and with all the bleakness of the earlier conversation about what we do not have adequate insurance, the positive is we do not have adequate insurance, therefore you're drawing on a blank slate. Whereas if you try to do this in the US, you'll struggle.
Correct.
Same in the UK, because no one wants to mess around with NHS.
I actually, and maybe I'll bring it back to the point that we were talking about before. I see, because we're doing one or two transactions in the sector at the moment, actually, so I have a bit of a privileged view, I suppose, on that. And I agree with you. It's a sector that I guess we'd all love to see develop better in Africa. The penetration is so low at the moment of health insurance. It's really scary, actually. I see a role for VC in it, and I see a role for strategic. And I guess the question to you is, because there's a lot of investment that's going to be required, and there are going to be losses that have to be taken by these companies, right? Because you're marketing a product that a lot of people at the moment don't think that they need, I suppose, or don't want, frankly.
But combined with that is the goodwill that you're expecting from, goodwill, good life, but you're expecting the government to have some kind of vested investment in the healthcare of the population, which sadly, in some of these countries, some of our countries, we can't see the wood for the trees on that. So how do you marry both, the investment that's needed plus the good government backing to be able to get these things done, which are crucial? So
in my view, first of all, starting with the investment, in terms of the structure, it needs to be more, it cannot be a traditional, so LeapFrog Fund 4, for instance, will struggle to invest into something like this because we will need to start showing exit now for this fund in about 3 to 4 years.
Yeah, so it's not enough time.
This is not going to happen.
Yeah.
Even if I had a completely new fund starting today and I had 10 years, maybe, but even then I would be a bit more apprehensive. So this has to be something which someone like us could manage, but with bringing in new teams, new people. But it has to be a platform into which investors put in money and expect returns over a 12-year horizon. There could be secondaries in between. So it has to be a long-term play, a combination of DFI, strategics, as you rightly pointed out, because they have an incentive to do it.
Exactly.
So that's on the investment side. With regards to the governments, public servants, and so on, my own view is if one government does it and does it well, then it will catch. This gain, we have seen it in Vietnam, we have seen it in India a lot, actually. So around 2009, a few years before that, one state government launched pretty much what I just described, but without this whole tech wellness piece. It was literally catastrophic illnesses. I want it covered. That was the one leader said, I want this done. He got it done. He made sure that it was well protected from any corrupt influences. And that once that became a success, he was impossible to beat in elections.
Yeah.
Because people
but
were...
it's true. It's such a simple idea which everyone will catch on because everyone's health is something that they care about. Yeah.
Particularly in Kenya, and I think it's true of India, most of these markets, the rising middle class, they just want basically two things: education healthcare, right? So, and healthcare is something you can't completely control. Education you somehow figure out, and you send your kids to some schools. You just massive catastrophic events could wipe all of that off. So when someone takes that cognitive stress away from you, like, I don't want this guy to ever lose an election. So if people see that, I think it could change. So it's a matter of one win.
Good advice for politicians
Very
as well.
good.
Here,
Combined. Let's talk about, we've strayed so much away from the actual transaction itself. Let's talk about a bit about LeapFrog. And your play is profit with purpose. And how do you balance the financial part, commercial part of your transactions together with now the social impact that you want to have?
So on the financial side, it's a very, very straightforward. It goes back to what I was saying right at the beginning as to my reasons for doing what I'm doing. That market across Asia and Africa, whether you're talking about Kenya, India, Vietnam, Philippines, all of these countries, that is the largest market, which is people who were poor a generation ago now have a little bit of money and are rising, but they need to consume. They need to consume healthcare, education, food. Hopefully, they are able to do it in a sustainable manner. And so for businesses that are smart, innovative, leverage technology smartly to service these masses, this is the largest and fastest growing segment. So it's a no-brainer.
Correct.
So then it's a question. So financial returns will be there as long as you are good enough to cater to them. They are not. This market is not easy to cater to. The cost sensitive, price sensitive. Therefore, you have to be cost sensitive. They are. They want good quality, and you need to listen to these consumers. So LeapFrog's special sauce has been able to figure out which are the companies that are able to do all of those, the discipline and execution to be able to provide high quality services at the lowest possible price, which is able to leverage emerging technology. We have seen companies which have used the ubiquitous mobile phone as it grows to provide financial access, to provide healthcare. We have seen companies which are using generative AI to provide access to healthcare. Again, it's being used more and more in financial services as well, bring down costs, increase scale. So there is that perfect synergy between the financial returns and impact if one follows that basic philosophy. We are also, very careful about measuring impact and communicating it to our investors. We could claim to be market leaders in some ways in that respect. For instance, in the case of healthcare, we became the first private equity impact investment fund to not just measure the scale. So in the case of Good Life, we reached 2.6 million customers, emerging consumers, people earning $10, $11 or less per family, per household, per month. So we went beyond that. We do that. So in the case of Good Life, from the time we invested to the time we exited, that number has scaled 2.6 times. So we do measure that. But in addition to that, one of our portfolio companies in India, we started working with a UK impact measurement firm to come up and help us understand the disability adjusted life years saved as a result of its intervention. So if you are going to this diagnostic company, Redcliffe, getting a test done, the detection of cholesterol, how many years of your life have you saved, disability adjusted? That also gives a massive understanding of the impact.
Correct.
So theoretically, financial returns impact should be combined because we are targeting this emerging market, and then we are very, very careful about measuring and communicating.
But also, I think impact is different, and you've just identified there's different levels, measures of impact, which can be assessed and give a good idea. But when you first were attracted to the Good Life investment, what was it about it that you thought this is key to what we want to achieve?
In my own case, I invested in or led an investment into Good Life even before LeapFrog did. That was in around 2014. I'll speak about myself and then
as an angel.
LeapFrog. No, it was when I was at IFC.
Okay.
This was around the time the very sad Westgate tragedy happened. At that point, what would end up becoming Good Life was Mimosa Pharmacy. That was the nucleus of this consolidated platform that was put together by Catalyst. And they lost their primary store in that attack. So as a result, the company suddenly went into distress. They continued with the transaction, but did not have the capital, because it was primarily it was a secondary transaction, did not have the capital to scale it. So IFC came in with a very well structured mezz debt product, where the cash would come in immediately, but the repayment would kick in only in year 7.
Oh wow! So, I mean, that's very generous.
It was an incredible structure, but on the positive side for the investor, for IFC, they also got upside sharing through various mechanisms, which meant that at the end of that time period, they actually made very good returns in dollars. So it was one of those cases where a DFI went out there, did a very commercial deal, but by providing the kind of flexibility that a normal investor couldn't have, and made money out of it at the end of it all, and played a part in building what is today the largest pharmacy retail network. The reason why it was attractive at that point of time, and this is same for when LeapFrog came in, I think 3 years after that, is the following. One, it is a no-brainer that every reasonable economy and health system ought to have at least one, ideally many formal retail pharmacy networks. The reason for that is what we talked about earlier as well. When you have fragmented mom and pop stores of any kind, but definitely in healthcare, you are not entirely sure what you're getting when you walk in through the doors. You might get good quality, you might not. Your store might be top notch, running to global standards. Ed's might not, right? So it is important to have, particularly as a consumer, a sense of consistency across whichever store you walk into. Second, it is a pretty large segment. Even today, there are, I think, 15,000 pharmacies operating in the country, pretty large market. So the total addressable market was very, very large. So whoever built this out could have achieved financial return as well as massive social impact. So the basic...
the tenants were already there.
It was in place. And then the next question is, what does one need to do? And we can get into that if necessary, but at a high level, listen to the consumer, execute with frugal innovation in mind, and then change, evolve as the consumer needs and the market needs change.
Yeah. Ed, go ahead.
Yeah, I wanted to get into the transaction itself. So we obviously worked together on the transaction in conjunction with Ed Burbidge and Nedbank. In fact, I think as your friend, I probably started convincing you of the benefits of working with advisors on transactions and that kind of thing. I hope you've forgiven me for, for that by now. But I wondered if you'd be happy to speak a bit generally about the transaction process, working with advisors, not just financial but also legal.
It wasn't us though, Ed. It wasn't.
Okay, maybe you can talk generically.
You can name. all in good jest. Yes, you can. Yeah.
No, about the process and the learnings from it. If that's
I think firstly, and I'm not saying this to be polite, the work with yourself and Nedbank was truly exceptional. We at various stages, we felt that you were able to bring in some neutrality that helped both us and the seller, the buyer, come and find middle ground. Same with everyone else that we worked with, on the law firm, Paris and Bowman, everyone. I think it was great. It just again goes back to the level of professionalism we have in these markets, and when one sometimes thinks of things that have not gone well, it is mostly because of macro headwinds and real difficulties, as opposed to quality of people. So on that front, it was fantastic. Also, the buyers, there were fair on most counts. With regards to the process itself, I think what helped was the fact that CFAO had been shareholders for about 3-4 years by the time we did the deal. And while they were relatively small shareholders, we took a clear decision to be exceptionally open and give them access to pretty much anything they wanted, from Exco to obviously board, but also great levels of details of operations, financials, etc. Because there was nothing to hide. This something that we all are very proud of. It was a top-notch business run with the highest quality, ethics, financial propriety, and so on. So once they got clear comfort over that period of time, then by the time we were looking to do the deal, they knew exactly what they wanted, what mitigants they needed, and possibly what price they're willing to pay.
Yeah.
Can I ask one more question?
Sure.
On it, and I think we were talking a little bit about it before. I think it's a remarkable achievement.
Yeah.
Right. What's been done with Good Life? I feel very impressed and very proud, actually, of what you've achieved with that business. And I think, again, in terms of learnings for other private equity venture capital investors here, I hope it's not depressing in terms of what you have to achieve in that kind of market positioning in order to get an exit. But so I think if you can talk a little bit about that, about positioning businesses within their market to attract international buyers, and how people can do that with their existing portfolios. And I think you mentioned another interesting point, which was the combination of international experience but also local execution at the senior management and board level.
Very good question, Ed. Yeah. Go ahead.
So when one looks back, there are several things that I think we as a team did well. There are a few that we wish we would have done better. But those things that we did well, one, we discussed this earlier, pick the right space and set out to build the market leader in that space. So there was ambition, but it was also realistic. We were not talking about doing something that doesn't exist anywhere else. In fact, it did exist even in Kenya. It's just that it was fragmented.
Yeah.
Right. So number one was that the total addressable market was there. We just said we'll build the best and the number one there. Second, in terms of execution, right from the beginning, it was always about building something that had world-class quality. And that was the covenant that we were willing to and stood behind to the customer. We said we will ensure that the supply chain is bulletproof, and therefore you will, whatever you're buying, what is on the label is what you're going to pop into your body. So that I think was very important, and whatever investment was required to be made there was made.
But that's easy to say and very hard to execute. I'm sure that must have been remarkably challenging and expensive.
It was challenging, and I think one could have done it cheaper. I don't think it, as in if we didn't have that covenant, we could have taken other shortcuts.
Yeah, but you do feel as if the brand has stood the test of time, and I think most people would. That's why.
I think the most people who are most critical as well will say, okay, quality wise, we can't blame these guys.
Exactly.
And the fact that there are 150 stores now around the country where you can walk in and get that, it's a big deal. It didn't exist when I came here, like 2009, it wasn't there.
Yeah.
So definitely that's something to be proud of. I think there comes this piece around global, local. So to some extent, when Catalyst bought in two individuals who had worked in large international businesses in the same space, Boots to be specific, and they bought in a lot of the understanding about how this could be done. However, very quickly that the benefits of that were outweighed by the lack of knowledge of local markets, wherein there was a need for a transition. And I think it is a natural evolution, so to speak. And LeapFrog was able to bring in high quality management team. Aman Khalfan, who was CEO for a very long time, had helped Aga Khan set up its primary healthcare network. All these Aga Khan clinics that you saw, he set it up. So he and he's Kenyan, so he knows the markets. He's run around, done the hard work. Khalifi is not like some. He knows. He's been there growing up, I guess. So that's then, and then of course Justin, who was his right hand man on the as a CEO. He was a former executive in the food retail space. So again, knew new retail and knew Kenya, again Kenyan gentleman. So between them, there are many others that are critical parts of Good Life's management team. But these guys took the quality ethos and then made sure that on top of that they were layering in all the local understanding, particularly of the customers. And then thirdly, we as a firm have a special sauce, which is our consumer insights team. I don't think any other private equity fund has it. I could be wrong. But these are individuals who have, whose basic expertise is in understanding customers. So every deal that LeapFrog does, whether it's in financial services, climate, or healthcare, even before we do the transaction, our consumer insights team comes in, talks directly to the end consumer, understands how is it that this particular company is servicing their needs, what could be done better, etc., etc. And then as part of our value creation plan, come in and support the company. So in the case of Good Life, one major lever was when our team helped the management team at Good Life put together the famous customer loyalty program. So it was around 7,000, 10,000 a few years ago. Now 500,000 Kenyans are members of that loyalty program. As a result of which, about 70% of our sales, of Good Life sales, comes from those 500,000 people, though 2.6 million customers walk through our doors.
Amazing.
So a big chunk is coming from them. There's a huge stickiness as well. So that's the other element that was put in place. Thirdly, the management team has been really, really nimble. Again, that local connection. When COVID happened, overnight, they managed to come up with the Good Life home delivery system, work closely with regulators to make sure that it is meeting whatever regulatory requirements are necessary. And now it went from 0 to now I think about 10-15% of the top line. Gosh. So again, something which didn't exist was overnight created. There are many examples of this quick pivoting to, and sometimes things don't work. We try to roll out a low cost, small format, slightly different branding, just couldn't make it work because everyone wants to walk into the more traditional Good Life and get that experience. So this we just at this stage at least couldn't make it work. Hopefully it will in the future.
Well, huge congratulations to you. I mean, amazing achievement, and really, really proud that this has happened in this market and as an example of something that can work, overall on exits, because I think everyone is concerned about exiting at this stage.
That's for sure.
Yeah.
Thank you. But again, it's a lot of people across our organization over many years, but also other organizations who have played a big role as so LeapFrog, obviously many individuals, people at Good Life, the management team. As I said, IFC, they took that massive risk. It would have been bankrupt if that they had not.
The Mez instrument is really interesting.
Propaco came in, is still a lend, I think recently paid off. So many, and CFA of course, who came in 3 years ago and helped get it to where it is today. So I think a lot of organizations, people have played a big role.
Amazing.
We are very proud to have played a part in that as well.
Congratulations, Biju. I want to do very quick questions. Advice for entrepreneurs, entrepreneurs who are in the healthcare space. How do they make sure they get someone like a LeapFrog or someone else to look at them in the way that they should be looked at for investment purposes?
I would say 3 buckets. One, be pragmatic and do a realistic assessment of the market. So make sure that the total addressable market you're talking about is real. It's not just theoretical, it is real. People are paying for it. I would always prefer they are already doing this, they are already paying this, I will do it better and I'll take a big chunk of it, as opposed to, they will pay for this. So that's one, be realistic. At the same time, obviously, be ambitious and creative. That's it's rare for those two things to exist.
Not to coexist.
No,
not to
coexist. To be honest, when they coexist, it's great, but it's rare.
Okay.
Where you're realistic, but also creative and ambitious. So an example of that would be. Pretty much Good Life, since we are talking about it. It was 3 to 4 stores. Now it is 150. So it is possible, but we had to be, and the management team had to be creative while being ambitious at the same time. And then in between those two is this whole point around valuations and so on and so forth. I would personally recommend that entrepreneurs focus more on unit economics, profitability, getting steady growth, and
that's
not
excellent advice.
Rather than focusing on the valuations.
Not in the short term. The reason I'm assuming people focus on the valuation is dilution, obviously. So right at the beginning, figure out, okay, this is what I think I'll end up owning of this business at X point of time, and bring in the right investors, the right investment structures. People like Ed and yourself can help with the investment structures, right?
Thanks for that shout out, Biju.
No, it's true. The mezzanine instruments, for instance, if you need early on, and then obviously equity when you're really solid and when you feel you can claim a certain valuation. But until then, figure out how to manage that balance.
I agree. I mean, I obviously, stepping out of my investment banker suit into my business owner suit, I set up my own business and then I sold it, obviously, over time. But I sold 65% to begin with to I&M. And when I did that, I looked much more at what my 35% was going to be worth as a result of the synergies of the transaction than what hanging on to. Well, I compared that to hanging on to 100% and keeping it all to myself. And in terms of long-term value, which is what you're talking about, thankfully that was a good decision and a good approach. And I also think in the market these days, what we see in terms of financiers of African businesses, and you were talking about it earlier, there's a lot more risk aversion around, right? People are not throwing money at everything and hoping for the best and just looking at revenue growth and hoping the profit comes later. They want to see the profit coming through already and tangible profitability, cash flow, sustainable numbers coming through before they even think about investing. So I think those are the priorities for business owners.
And then, Biju, anyone who wants to do your job, what advice do you have for them?
The reality is, when I started this in 2008, 7, I wouldn't have hired myself. That's the truth, because I had no investment experience. I was coming in from back of the beyonds, having served 5 years in the army and so on. So someone took a leap of faith. So I hope they find someone who takes a leap of faith in him or her. Other than that, it's just, again, quoting from, I have a lot of great friends, so I'm quoting instead of like Ed quoting from great poets and so on, I just quote my friends. So she once told me it's about taking one foot, keeping your head on looking at the ground and taking one foot at a time, right? Okay. And sometimes one has, one ought to have ambition and creativity, but it's just do the right thing every single day.
Okay, excellent. Well, you've been an excellent guest. Thank you so much for the discussion. Ed, how did you find it?
Fascinating and really enjoyable and insightful, actually.
Yeah, I think great insights, Biju. And I think, a real testament to putting together a business that someone would definitely and solidly be interested in, and that's where you can get a very positive exit for yourself. And congratulations to you guys and your team.
Yeah.
Thank you very much. I think there are many such businesses ready to be built in Kenya and other parts of the continent, and we are excited to continue to do
and
that.
I'm really excited to see the potential of those platforms that you're talking about, if people can really get their heads together and make it work.
Yeah, I think again, going back to, if you take some insights from the story, the reason I brought up all these different organizations, it's easy to just claim credit ourselves, and we have done a lot of work. A lot of people have been really, really creative, ambitious, all of those things that I said, but it wouldn't have happened if different stakeholders hadn't pitched in at various points of time. So I think for anything ambitious and great to be built, we do need the DFIs to come in. We do need strategics to play a role.
Yeah.
We do need bankers and lawyers to figure out some creative solutions. And then at the end of the day, there will be one lead executioner with management teams.
Okay.
So I'm excited to, again, hopefully bring all of those things together for this other platform that we were dreaming about.
What's next? Can you tell us or not?
No, there's nothing specific in the next, but for if you say next 10 years, as what would LeapFrog love to build out in Africa, I would say this. Yeah. It would be this health insurance platform. Okay. Would love to do that.
I'd love to see it. I'd love to be part of it. Wouldn't you, Ed?
Yeah, we're running
so pro bono legal, pro bono. Okay, we are done.
Yeah.
I didn't hear
or
that.
Or at least low bono.
What did he say?
He didn't say anything. Okay, let's do the quick fire round, Biju, and then we're out of here, because I know we've taken enough of your time. Okay, safari, coast trip, or coast. Where in the coast? Kilifi. I know.
Yes.
I don't need that answer. If you weren't doing your current job, if you went to the army, what would you be doing?
I would be a historian, writing books books for kids.
Oh,
history
cool.
Books for kids. Yeah.
Which part of history do you love?
So I would, for instance, want to write about Queen Amani Reina of Sudan and how she pushed back Emperor Augustus's army and got him to. And also there are many others. For instance, someone like you who knows so much, or Ed, I don't know whether you would have read about, say, Raja Chola, this brilliant Tamil emperor who extended. He created a massive Southeast Asian empire, which is why in Thailand today or Indonesia you find all these Hindu temples, and that's because of this guy.
Which
so there are people like this that my kids don't know. They know all about Henry and his wives.
So do I.
Yeah. But they don't know about Chola.
Henry VIII. Yeah. Okay. Favorite city in Africa?
Nairobi, man. How can I not?
Okay. Ed, would say Nairobi.
Definitely. I think it's my favorite city in the world now.
Until Kilifi becomes a city.
Yeah. That's true, obviously.
Best advice you've ever received in one line only. Don't be a trash can. Is that the one?
That's a very good one. But since I've already said that, and I've said, follow best advice I have ever received.
Ed, do you have yours?
Yeah. There is one that I always think of actually, which goes something like, you'll probably know the exact words better than me. Something like, when you're starting your career, you get paid in experience, and later you get paid in money.
Yeah. The very good one.
Ed has all these very practical.
He's very on the spot. Yeah.
This morning.
In my case, I think the best advice would be go where I'm not saying it properly, but in a sense, can I give a little bit of a story?
Of course.
So when I was in the army, we used to have floods happening in this massive river called Brahmaputra, and every year the army would be called to go and provide relief. So it's a strange sight because everyone is fleeing away from there and you're fleeing towards it. So take more risks.
Yeah. Okay. Go towards where
the action
is.
Right? It may be not logical to go towards flooding waters, but sometimes that's how you build yourself and your character life and have adventures.
Amazing. I mean, you wouldn't be here if that wasn't the case. Yeah,
exactly. So my CEO called me when I was in Hyderabad. By the way, can you do this? I said yes. I only reason I wanted to come to Nairobi was to do Masai Mara at some point. There was no intention at all.
Hidden talent, Ed, Biju?
None. I'm still trying to find it.
Okay.
Someday.
Sailing.
Yeah. Yeah, you guys got a boat.
He's an amazing sailor, actually. Amazing. Yeah, and his son.
Yeah, my
He's
son
going to
is
be
a
sailing for
Amazing.
India soon, hopefully.
Oh gosh,
Fingers
please no. Please no. Anyway, you've been an amazing guest. Thank you so much, Ed, for
Thanks,
co-hosting
Jerry.
with
Thanks
me.
for having me. I'm
No,
so
you were
grateful.
so
I'm
good.
so honoured to be here.
No,
Thank you very much.
Thank you so
for
much.
that.
Thank you so much, Biju, for taking the time.
I had a lot of fun.
I
Thank you
really
for-
appreciate it. Really
thank you for
appreciate
having
it.
me.
And congratulations again. Everyone, this has been a brilliant podcast. I can't say much more about, LeapFrog's exit from Good Life Pharmacies. And I think it's just been excellent. Thank you so much. Take care of yourselves, everyone.